We turn to the latest in the fight against COVID-19, and the Ford government is putting a pause on any further lifting of public health restrictions and capacity limits.
It comes as new COVID-19 projections are released and as health officials try to learn more about the potential impact of the Omicron variant and as cases of the Delta variant continue to surge. CTV's Queen's Park Bureau Chief Colin DeMello joins us live with the latest. Colin.
Well, hey, good afternoon, Raheem. Yeah, the Ontario Science Advisory Table is really charting the course for what we can expect over the next month and a half. And the Delta variant is really going to continue to drive up cases in Ontario. Right now, Delta is responsible for 99.8% of all of the cases in this province. Omicron is slowly creeping up. But they say with the Delta variant, here's what we can expect. Under the best case scenario, 1,000 cases per day in mid-January. Under the worst case scenario, up to 3,000 cases per day again in mid-January. And the worst case scenario is if our behavior doesn't change, the Science Advisory Table says, and if only 30% of children 5 to 11 are actually vaccinated. Currently, we're above 20% in Ontario with those children 5 to 11 vaccinated. Of course, there are the downstream effects. The Science Advisory Table says it will impact our hospitals and our ICUs. They are projecting by mid-January between 200 to 400 people in intensive care in Ontario, again, just with the Delta variant. As for Omicron, that is the big unknown. The Science Advisory Table says it is highly transmissible, and as a result, the case counts and the ICU admissions could be higher, but they just don't know how high right now. Take a listen to Dr. Peter Uni, who is the science advisor, one of the Science Advisory Table members.
It looks much better than a year ago. Again, we just need to be aware of that. We're not out of the woods. The point is that, again, depending on what we're doing, we should hopefully be able, if we decrease our contact rates by 15%, and then really just keep going with the third doses and the vaccination of children, we should be able to keep our ICU numbers below roughly 250 to 300.
And so the 250 to 300 number is an important one. The province is saying today that Ontario has been steadily building up hospital capacity, and it's now able to, quote, safely admit approximately 300 patients with COVID-19 into the province's ICUs, while at the same time maintaining its capacity for non-COVID urgent surgeries. The province saying it can quickly ramp up capacity if needed. The Ontario Hospital Association, though, is reacting negatively to that. They're saying that this is not what they wanted to hear. They're saying that the hospital system is under strain, and they're saying hospital workers are burned out, not looking forward to the idea of having their hospital wards overwhelmed once again with COVID-19 patients.
All right, thanks for that, Colin. And if you can, before we let you go here, can you bring us up to speed on another situation? Because we understand there was a tense moment inside the legislature today.
Yeah, MPP Belinda Carahalios, who used to be a member of the Progressive Conservative Caucus, was ejected from that caucus during the pandemic. She tested positive for COVID-19 a few weeks ago during the end of November, and she came into the legislature today despite some rules preventing her from doing so. She had to take a negative COVID-19 test before coming into the legislature, which she says she did, but nevertheless, she was inside the chamber, and the Speaker, Ted Arnott, gave her a caution before ultimately booting her out of the legislature. Take a listen.
As the member knows full well, having being unvaccinated and having tested positive for COVID-19, the current advice from the public officer of health is that she must be out of the chamber for the next 90 days, starting from the date upon which she tested positive. I'll ask the member once again to leave the chamber and leave the precinct.
So Belinda Carahalios refused to do that. Eventually, she was removed by the Sergeant-at-Arms and is now prevented from re-entering the legislature for a time of about 90 days. She issued a statement on Twitter saying, quote, "Today I entered the legislature with a negative COVID-19 test. After taking my seat to ask the Ford PC government a question, the Speaker had me removed," she says, despite being the MPP, in her words, least likely to spread COVID-19. She says this is an affront to to democracy. Busy day here at Queen's Park. The Chief Medical Officer of Health will be responding, Raheem and Michelle, to the COVID-19 modeling that we got. That'll happen at about 1:30 this afternoon. Reporting live at Queen's Park, I'm Colin DeMello. Now back to you.